Good morning. This is the BLAINESWORLD podcast that can be found each week on Facebook, YouTube, and LinkedIn. You can also listen in on Spotify or Apple Podcasts. And you can get more information, listen to previous shows on our website, www.blainesworld.net. I'm your host, Blaine Greenfield. I'm here at my Zoom studio in lovely downtown Fairview, North Carolina. Each week, we focus on positive news and information about people and organizations in both Western North Carolina and throughout the country. And to that end, it's my pleasure to introduce Dr. Virginia Plaisted, who's a dentist in the area and also goes by the name of Jenny. And Jenny, you can feel free to wave to all your fans and friends on Facebook. Or if they're watching this Facebook, you can wave, LinkedIn, you name it. And Dr. Jenny had owned her own dental practice in upstate New York for over 34 years. Very interesting. When I see that figure, it's true that you were like the youngest person who ever owned a dental practice. You started what, was it 9 or 10?
Oh, 9, definitely.
9. I mean, my God, the youngest person in upstate New York to ever own a dental practice. Pretty impressive. After moving to Asheville, she's worked as an associate at Dr. Tim Gillespie's office since 2015. She enjoys swimming, quilting, hiking. She's especially pleased to see dentistry improve and get easier for patients over the years. And that's kind of a key point we were talking about off the air about dentistry being made easier. And before we talk about your background, just let me ask you explain that concept that dentistry has been made easier. How so?
Technology, of course. The technological developments in dentistry in the last 40 years has been amazing. We never had implants. The implants started in the late 1970s, and they weren't universal till the end of the 1990s. And of course, today, almost all dentists place implants to replace teeth that are lost.
Well, so before that happened, if I need a tooth to be replaced, what would happen? It'd just be nothing.
You'd have a space. You could do a temporary partial denture. You could, it would be removable. Whatever we use to replace that tooth would be removable, or that would be a bridge which cements on the teeth on either side.
But when I had, again, an implant, that's what was done. That if not, they would have had to remove the tooth. Is that it?
Well, no. When you remove the tooth,
right,
and you have the space, the implant is a titanium piece that is placed into the bone, and then we can put a tooth on top of that. And today we use CT scans to know exactly where all the anatomy is. And it's a very simple procedure now to place an implant.
And before it was pretty complex.
Yes.
Yeah.
And so, limited success. Success rate is around 95% now.
We'll talk about that too, because I remember the one time I had an implant. I wish I had had you explain it to me, but it was done, but didn't work the first time. That does happen sometimes.
It does happen sometimes, and we really don't know why. It can be related to general health. There are just times where we can't come up with an answer.
So when that happens, then it gets done a second time, and it usually works the second time?
Yes. Yes.
Now, I should ask you, maybe it's a naive question, but if I can ask you, explain, you kind of hear the concept all the time, but I don't know that I can explain it. What exactly is an implant?
An implant is a replacement of the root of the tooth in the bone. So when you take the root out, you let the bone heal, and then I hate the terminology, but you drill a hole in the bone, which, by the way, there's no nerve endings in bone, so it is not a painful procedure. Right. And it's like putting a screw in, but you have to use a specific type of metal. Titanium is a fabulous metal to use for that. And then once the bone attaches to that titanium, you put a crown on it, and you use it as if you would have a natural tooth. Now,
if I didn't do that, what would be my options? Not many.
You would be able to get a bridge, which means you have to cut down the teeth on either side of the space, and then do what we call a 3-unit bridge, which is a crown connected to a fake tooth connected to another crown. You can do nothing. That's always an option. But when you do nothing, teeth move around. And the other option is a removable partial denture.
Now, why would somebody do that?
Usually if they have 2, 3, 4, 5 teeth missing, they would do a removable partial denture because of cost.
And talking about cost, which I don't know about you, but it certainly bothers me a little bit by the fact that I have all sorts of medical insurance still. I have some dental insurance, but unfortunately, dental insurance never quite matches up to the medical insurance. And that's a shame when you think about it, and a lot of people, I guess too many people, have no dental insurance.
Most people after the age of 65 have no dental insurance. And the problem with dental, the difference between medical and dental is with medical insurance, you would never even use it till you're 30 or 40. And not everybody uses medical insurance.
Right.
Dental insurance, everyone needs dental insurance. Everyone. So you're not getting your bang for your buck that way, because if you pay for insurance, the insurance company takes 34% for administrative costs. So for every dollar spent on dental insurance, you're not getting any more than maybe 65, 66% back. That would be great if only half of the people went to the dentist.
Right.
So if your employer pays for dental insurance, only maybe 50% of the people are going to take advantage of that in a big company. Now it's insurance and it works.
Because it's a shame that people don't have the insurance or any insurance.
Oh, exactly.
Right. I saw this years ago at a dentist, and this maybe before HIPAA, or they weren't following HIPAA regulations. But I heard the guy next to me, and they're explaining to him, well, we can fix it or remove it. And it was purely an economic cost, because removing it, right, was a lot cheaper than fixing it.
It usually is, yes.
Yeah.
And that's a very sad, thing.
And there was no option to the person, he just didn't have the money, and to fix it would have been fairly expensive. So he chose to remove it.
And 50 years, 100 years ago, that's the only choices.
Yeah.
So it's much better today than it was.
With respect to
interesting fact that to go along, I have a few interesting facts here.
Okay, please.
People who have 20 teeth or more at age 70 live significantly longer than people who have less than 20 teeth at age 70.
What do you think?
It's a sad thing to lose teeth because of finances.
Why do you think that's true, though? The figure of that's kind of an interesting figure, but why so?
It comes down to the bacteria in your mouth. It comes down to chewing and chewing force. Without chewing, you're not getting the right nutrition because the saliva is not mixing with the food properly before you swallow.
And
also,
go ahead. I'm sorry.
People don't smile as much. And smiling sets off a neurological change in the brain that releases dopamine and makes you happier. Even fake smiling is helpful if you have some minor depression. Not major depression, but even if you fake a smile, you will feel better.
Well, it's so funny you said that, because I remember my mother, one time she had had some dental work, and she refused to be seen anywhere because she didn't, she didn't want her teeth to be seen or her mouth to be seen. Yeah. And I guess there are a lot of people like that. And
there are a lot of, you see social interaction.
You see ads on that too, that people, they're kind of compelling ads that people say their lives were changed and they can now smile for the first time because their teeth are looking good,
Right.
Talk a little bit more about that in terms of teeth looking good, and I have a couple of questions on that. But one, something as basic as a teeth whitening. Does that work at all?
It does work to some degree, but you have to keep up with it. And I like to take the focus off of that part of cosmetic dentistry. I really do, Blaine, because I want to see people smile with their teeth that they have 20 or more teeth, so their nutrition is good, and to prevent periodontal disease.
I'm looking at your teeth. I mean, they look great, or I mean, they're white. What a great smile. Is that always been the case, or is that
Absolutely not. I have terrible teeth.
really? Oh, I couldn't
I,
tell it.
I wore my teeth down, clenching and grinding, and I have crowns on almost every tooth. And my dad also did the same thing. So it's a genetic factor.
But
I have
that's interesting. Clenching and grinding. Explain what that is, or why do people do that?
Well, a lot of it comes from anxiety. I think it is instinctual. You'll see animals grind, and even horses will grind their teeth to the point where they'll grind on one side of their mouth, and they will have to have a specialist come in and fix their bite. And we do that also.
What, your practice?
Grind our teeth and have to have what's called bite adjustment sometimes.
Yeah, because Cynthia has that problem, I think, or she's been told she grinds her teeth, and that can cause problems down the road.
Oh, sure. And part of the issue is our posture today. We're on computers, we're on cell phones.
Right.
Your head weighs what, 7 times as much when it's over, when you're leaning over versus if it's over your shoulders appropriately.
Interesting.
Very bad for your neck, your cervical vertebra. It puts these joints in a different position, which you then clench and grind and break teeth.
You know, who would have thunk, I never thought of it, but you're absolutely right. I'm on the computer too much,
Yeah.
and like I said, I'm always leaning forward.
Yeah.
Interesting. Talk about something else too. My dentist does, and I assume all dentists do, or more recently do. They also check my tongue. Is that part of the whole process?
Sure. Oral cancer is one of the more deadly cancers today. So we always look at the back side of the tongue to make and to see if there's any problems. Yeah,
Have
there's
you
got a lot
noticed?
of people
Have you noticed people with problems come in?
I have. The good news is I've never seen oral cancer in a patient.
Right.
I've seen basal cell on lips, basal cell carcinoma on lips, but that's locally invasive and your dermatologist can take care of that pretty quickly. But there's also some other health problems we can see. If you have uncontrolled diabetes, your gums are gonna be inflamed. There's oftentimes that the tissues don't look, the whole mouth and the tissues in the mouth don't look great, and we'll send you off to your primary care doctor for a checkup.
Well, I'm very impressed too. My dentist also, or the technician, checks under my neck and the glands as well.
Yes.
And what are they looking for there?
We're looking at the thyroid, we're looking at any type of cancer in your head and neck area. We're looking for tightness in the muscles, because we can have an idea if you're clenching and grinding by your neck muscles.
And if you are clenching and grinding, what can be done about it?
There's a number of things. You can get a night guard and wear it when you sleep. You can go to physical therapy and have them teach you how to keep your back up and straight, and they'll work with strengthen your mid back so that your posture is better. Another treatment coming down the line, it's not widely available at this point, is Botox.
Right.
Or the muscles for clenching and grinding, and it works wonderfully. The issue we have is there's no coverage by medical or
I was going to say that. And
yeah.
even in terms of Botox, so if I came to your practice, do you do that, or you send me elsewhere?
Actually, we're now looking into bringing it into our practice. We'd like to see it in our practice within the next year. Okay,
so you talk about times are changing. Talk about some other ways times are changing, and kind of some of this is basic for you, of course, but maybe for some of our listeners not. But let's take from the very basic. So the rule of thumb, I guess, if as a kid you're taught go to a dentist is it still the rule every 6 months?
You know where that came from?
No, that's why I asked.
It came from a commercial, from a jingle in the 50s. Yeah, brush twice a day and go to your dentist twice a year.
Right.
And the truth is, insurance companies went with that. We all go with that. But the truth is that some people can go a year.
Right.
Some people have to be in every 3 months. Some people every 4 months. That's between you and your hygienist. And basically what happens is the bacteria in your mouth forms colonies. and what's called a biofilm, and your hygienist gets rid of that's under the gums that you can't get rid of by just brushing and flossing. In fact, there are more bacteria in your mouth, Blaine, than there are people in the world. That's true with all of us, of course.
Right. Oh, I thought it was just me. So that points out, so that's kind of interesting. So you go to the dentist, but you also go to the person who takes care of your mouth also. And that, because she, it's usually a she, I guess. It's interesting, isn't it, that in terms of sexism, that most of the dentists still, and I'll ask you ballpark figures, I guess, but dentists are still mostly male. We'd say that's true.
No, over 40% now are female, and the schools are 50 to 52%.
Okay, but that's certainly over the last X number of years. It used to be there were never female dentists.
Oh, when I went, I was the third class to have any women at all.
Were you really? So
yeah.
And that was the class of
1998.
2001. So wait, but it's interesting. The reverse though, the people who take care of your teeth, hygienists, that still is mostly female, or is that changing?
And we try to change that. I'm not sure why that still is true, but it is. And being a hygienist does lend itself to a female who is going to have children, maybe work part-time for a while and then go back and work full-time. But we definitely try to attract men at this point.
Because again, I've never seen, I don't think, a male hygienist.
No.
And where I go, dentists, very fine practice, but they have a lot of hygienists, but they're all female,
Most of the hygienists that I've worked with that are male come out of the service.
Okay, is that it? Yeah.
Yeah.
Well, are some of them, I guess, it's just the way it is, are some of them, I guess, I don't know, frustrated dentists, or they would have wanted to be dentists, or they couldn't afford it to become a dentist, and they then fell into hygienists?
That happens, and I have had two hygienists I've worked for finish their undergrad and go on to become dentists.
Oh, really?
But some hygienists love it. We have hygienists that absolutely love what they do. And you see your patient on a regular basis, so you get to know them well.
Well, I can't believe, like you said, where I go, one hygienist has been there 25 years, another 21 years, that's quite a period of longevity. But I guess if they're good and the dentist likes them and they fit into practice, they're going to be there for a while.
Oh, sure, because they're also going to build, it's almost, you're building your own clientele in a way.
Right.
Some patients will they don't care about the dentist, they just go for the hygienist because they like the hygienist.
No, Cynthia's like that, it's so. And they always schedule, I guess you'd probably do that too. When you schedule, you typically schedule the same hygienist. Is that how it typically goes?
Sometimes it depends upon the practice. You try to do that, but it doesn't always work out. So, and it depends upon the team. If you have a good hygiene team, they're all together on the same page and they talk to each other. So
go back to somebody going to the dentist. So I like that. And I'm trying to think of the commercial. You kind of sang it before, where it said go to the dentist, and I do remember that. So you go to the hygienist, and let's talk about something that I was even getting advice on recently in terms of, so yes, you should floss, and talk a little bit about the flossing process. You should floss how many times a day?
That at least once a day. And another fun fact, people who floss once a day live 6 years longer.
Really?
They have less infections, less pneumonia, and less heart disease.
Yeah. Why do you think that's true?
The bacteria in your mouth gets into your bloodstream, which affects the plaque accumulation in the arteries. The infection and lung disease, you breathe in some of that bacteria into your lungs. In fact, the most recent research claims that people who get pneumonia in a hospital setting, 52% of the time, it's from bacteria in your mouth.
Interesting.
And who brushes their teeth when they're in the hospital? Nobody.
Exactly.
You certainly aren't flossing.
Well, it's interesting with the flossing, ties into another thing I want to ask your opinion on, and that's regular toothbrushes versus electric toothbrushes.
The hands down, electric toothbrushes work better.
Okay, because I'll tell you an interesting story about it, or more get your opinion on it. So Cynthia has used an electric toothbrush for a long time, but she uses, and I was told they're not great, but she uses one of the disposable kinds, right? And we were just told recently that the professional kind are a lot better than the
Yes,
disposable kind.
Oral-B or Sonicare are both very good brands. And you've got to remember to change the head of the toothbrush every 3 months
Yeah, really? Yeah.
because they do wear out.
Well, Cynthia would get angry with me in terms of when you go to the dentist. Is this universal that almost all dentists give you a toothbrush? Is that
Yes,
kind of a
pretty
universal?
much, yeah.
Yeah. So I was always upset, Ginny, though, because I love, I got attached to my toothbrush, and it would like it was perfectly good after 6 months, she said, no, you have to get rid of it. And I'd want to keep a toothbrush for 2 years, 3 years until the bristles,
Oh,
no, until it starts falling, the bristles start falling out. You
right,
develop this relationship with your toothbrush,
sure.
and she made me stop getting it. But then this the other day just told me what you said. Said don't use the disposable kind, electric toothbrush, use the professional kind. But here's an interesting thing, and to encourage people to, whatever you do, start doing it. Because the last time I'd gone to the dentist, I was embarrassed or whatnot, but the hygienist gave me a bad rating for my gums or something. That you rate them, it was 1 to 5, or how's the rating go?
It's 1 through 4, but we also mark each tooth, six
Right.
spots on each tooth.
Yeah.
And
So
1, 2, and 3 is healthy. Over 3, you're starting, gum disease.
yeah, so I thought I took relatively good care of my teeth, but I shouldn't admit to you, I got a 4.
Mhm,
Yet what was interesting, that's when Cynthia gave me at least the electric, the
mhm.
disposal kind. And the other day the hygienist said my teeth are fine. After like 6 months or a year, you can recover from that. You can get your
Yes, you can. Yes, you
you,
can. But the one thing to remember, as with everything, as we mature, we're more subject to illness and disease. So a 25-year-old who's not brushing and flossing is fine.
interesting.
You get to our age, our saliva flow decreases and our resistance to illness and bacteria decreases for most of us, not all of us, but most of us. We may have diabetes, we may have pre-diabetes, we may be on medication for blood pressure. There's a lot of changes in our lives.
What about another thing that again just happened recently to me? So I really timing couldn't be better because I'm getting all this free advice from you here, Jenny, and we're sharing it with the rest of the viewing audience. But the other day, my teeth were examined, and I was told I have a wisdom tooth that could be removed, but didn't have to be removed right away. They said they can tell there's going to be future problems with that, or what would get that kind of
Well,
recommendation?
there's different opinions on wisdom teeth everywhere. So if your dentist starts talking about a wisdom tooth possibly needing to be removed,
Right.
I would say plan it and have it out, because we don't like doing it. It's a surgical procedure, and there's always the potential of a side effect of a problem. But if you're gathering bacteria and you can't clean it, or you have decay and we can't get a drill back there to get it out, then it's time to get that tooth out. And the younger you are when you get your wisdom teeth out, the quicker you heal.
See, as a kid, right? I don't know if I got some removed, but I guess I'm asking the recommendation from me or anybody else. So how can they tell there's going to be a potential problem, or they recommend that think about it? Like what would you tell somebody to do?
Well, it depends upon the issue.
Right.
First of all, we don't know if they're going to be an issue.
Right.
Oh, well, that's not true. Many times we do know, but there's a big gray area there. And again, you've got to balance the fact that it's surgery with, will there be damage at some point? Now, if somebody has a huge cavity that's going to start hurting, or they have swelling of the tissues
Sure.
around the wisdom tooth, then I'm going to say we need to take that out. If someone is able to keep them clean and they're in and functioning, then we're going to try to keep them in. So it's very individual, very individual. And as a dentist, we have different philosophies. You may have one dentist that says if it doesn't hurt, don't try to fix it. Another dentist may look at it from a more preventive point of view. So we all are just a little different on that, because there is no black and white.
What about folks, and I'm not in that category, fortunately, but who are still afraid of going to the dentist? And I couldn't believe it the first time I heard about it, but a friend of mine was afraid just to go get their teeth cleaned. That bothered people. What brings that about?
Well, the first thing you think of is PTSD from something that happened as a child.
Okay.
And it could be they have generalized anxiety, and this is one area that bothers them. Why are people afraid to get on elevators? Why
Okay.
are people afraid of heights? So there may be no reason for it. It just is. It's common, I have to tell you that. And we usually use a pill to relax you. If you really need to be sedated, then honestly, at this point, I think you have to go to Charlotte now if you want to be completely
Oh, really?
sedated. Yeah.
But even people want to be sedated even for teeth cleaning?
Oh, yeah. The issue is what it takes to get the licensure to do that is extensive. So it's costly.
So you mentioned it's good to know for people who are dealing with this. And it was a shame, Ginny, I'm embarrassed to admit this, but my daughter didn't go to dentist for 8 years,
Mhm.
and I guess there are a lot of people out there like that. And she
Yes,
finally went because she was in excruciating pain, but I couldn't believe it. It wasn't necessarily the finances were the issue. She just didn't go for 8 years.
it's really common for kids to get out of college, and once
Well,
mom and dad aren't paying, they don't go.
that was my daughter,
No
exactly.
pain, why go if there's no pain?
Yeah, she exactly right. She was on
Mhm.
coverage, I think till 25 or whatever it was, but for
Yeah,
8 years she didn't go. And just what we talked about before, it's a shame because of the insurance issues, that this is, not covered.
it would be a huge cost, first of all.
Right.
And there would be absolutely minimal reason to brush and floss if you thought you could go get your teeth cleaned for free. I think it's just human nature. I mean, I can tell you, that people who lost their teeth live 6 years longer, but that's so far out there, people. They're gonna just say, I'm not gonna floss today. I have free dental care.
Well, talking about personal nature, what about your boys? Were they receptive to taking care of their teeth?
Two of them did. The third one was like, what do you mean I have to pay for a dental visit? Oh, yeah, I had to lean on them. Unfortunately, you do. It's
Okay,
very common.
but again, like I said, I couldn't believe it with my daughter. Let's kind of go back then a little bit. We glossed over this, but I'm always fascinated, Ginny, not only by your story, but everybody's story. And so you mentioned that when you went to dental school, you were like 3 people in the class or something,
There were
female.
10 people, 10 women out of 110.
Yeah. But even before then, what got you into wanting to become a dentist,
Well, I thought I wanted to be a physician.
right?
This is a true story. And I couldn't pull all-nighters, which meant in a residency, I'd be a mess.
Right.
And I looked at dentistry, and you have a lot more freedom as a dentist than you do as a physician to make your own decisions. And now the way dentistry has gone, it's fascinating. It's fabulous for the patients. I made the right choice. Maybe for the wrong reason, but I made the right choice.
Well, even in terms of dentistry, dentists are on call, but I guess also you get less calls at 3 o'clock in the morning. I guess as a doctor, or that's not necessarily true.
Oh, no, I don't think I've gotten a 3 a.m. call in 30 years.
Okay.
No, I was on call last weekend. I had one call at 10 o'clock on Sunday morning. They waited. I was able to talk them through. And now to try to open an office on the weekend, you can't, it's impossible to bring a staff member in, and as long as the patient, you can keep everything under control until the office is open. You're best doing that. And most of
Well,
us keep emergency visits open for Monday.
yeah. Well, talk about then in terms of if somebody is in pain. So obviously, there's contact the dentist as soon as possible.
Mhm.
Are there things they can do to get past the weekend, or gum numbing devices or stuff over the counter? Does that help?
None of those numbing devices really work. The best thing is Tylenol and Advil together.
Okay.
Tylenol and Advil together. And follow the directions on the bottle so you don't overdo it.
Right.
And don't lay flat on your back. Make sure your head is elevated. The blood pressure is lower in your head when your head's elevated, so you don't get the throbbing. And we will call in an antibiotic sometimes, up for a patient of record.
Right.
You know,
But
if you don't have a dentist and you try to call a dentist on the weekend, we
Right.
can't. We can't.
But that can get you through the weekend, at least if you do some of the things
Oh,
you
sure.
said.
Oh, sure.
You'll be able to deal with it.
If you call your own dentist with a problem, they're gonna walk you through, call in a prescription for you, and get you through the weekend. And, you know, we do, if you have somebody who has had an accident and has already gone to the ER and made sure they don't have any head trauma, we will go in and call a staff member in if you've broken teeth.
But going back to you, then I cut you off before, I'm sorry, but we're
Mhm.
talking about when you decided to become a dentist, but even before then, like a young woman growing up or a young girl, were you always interested in, well, just taking care of people or helping people or?
I loved biology.
Yeah.
I loved it. I can't explain it. And I did, I worked in the local hospital my senior year of high school. I worked in the hospital even during college. So, and I was a bit of a rebel. I did not like I was from a small town and my parents expected me to get married at 19. And that was the last thing I wanted to do. So, you know, I looked at medicine. And I'm glad I did.
So you became a dentist eventually, and then you said before you moved to Asheville, you had your own, yeah, was it your own practice?
Yes, I had my own practice.
Okay.
And I had an associate.
Okay, and you did that for a bunch of years,
34 years.
but who counts, right? And
Right.
so here you come to Asheville, and talk a little bit about that in terms of practice, the idea of having your own practice, which is in upstate New York, versus you entered into a practice here now, as part of a practice. What's your feeling about? Do you prefer individual owning it, or do you like what you're doing now better?
I like a group practice. And the reason is, well, I wasn't on my own. I was the owner.
Right, right.
But it's not, I had one associate sometimes too. It's very stressful owning a dental practice today. Small businesses, period, are difficult today. There's so many rules and regulations that you have to follow, whether you're a small business or a large business. It's very unwieldy. We in Asheville are getting quite a few dental service organizations. In other words, big companies are buying out small dental offices. And I don't think it's going to be, there's many, many negatives, many negatives. You go from, if you call Dr. Gillespie's office on the weekend, they're going to transfer you to one of us on call and you're going to talk to a dentist. If you call a dental service organization, and you may not know your dentist is sold out, by the way.
Right, right.
You're going to get a call center, God knows where.
Right.
And they're not going to be able to help you. Another issue is that if I need to call a specialist and they are in a dental service organization, I may not be able to reach that specialist in a timely manner to help my patient. And that has happened.
Well, the other big advantage, I know something I made the decision when we moved to Asheville, so I didn't want to go to a practice though with just one doctor, because again, if the dentist, and I know a very good practice, won't mention it by name, but if the dentist is sick or on vacation or whatever, you're out of luck.
Someone on call.
Yeah, they'll have someone on call. But I'm saying, nice thing, I guess, about Dr. Gillespie's practice or other practices is how many dentists, for example, with Dr. Gillespie?
2 full-time, 2 part-time.
Okay, so that's, you'll chances are you'll be able to get to see a dentist at some point in time.
Yes.
How many?
And
Yeah.
the technology is more affordable.
How many hygienists?
There are, on an average day, 4 hygienists working.
Wow. So you don't realize that, but it's quite a big, practice quite kind of really grown. And again, we were talking before, the hygienists have been there for a while.
Most of them have been there quite some time.
Okay. And I guess, let me ask you that, it's kind of hinting at kind of good recommendation in terms of choosing a dentist. If somebody is listening to the show or watching the show or moves to Asheville and want to find a dentist or anywhere in the country, what's the best bet to do when you're trying to find a dentist?
You can see if they have a fellowship degree, an FAGD. You go to the Academy of General Dentistry. and see a fellowship just means you've gotten a certain amount of continuing education in dentistry and taken an exam. You can call or contact, well, you can even get online with one of the institutes for continuing education in dentistry. There's the Dawson Institute, Pankey. There's a number of them. And they keep a list of who goes to those institutes for continuing education. And unfortunately, it's a difficult thing to know if your dentist or your physician is good, right?
Yeah, well, how do you find out? Well, one of the things that, back to finding out about dentists, one of the things that always impressed me about you, Jenny, is that whenever we speak, you're off to some conference or training or, additional education in dentistry practice. So you do that. I mean, you have to do it right by law. You have to have so many credits every so often.
In North Carolina, 20 credits a year, but you can get those credits online. It's invigorating to go to continuing ed, and it reduces burnout because you're with colleagues. You learn things from just talking to your colleagues at lunch. So it's a good, wonderful thing to do. And I think COVID really made that difficult, of course.
Well, people, I guess, weren't going to, they were doing most of it online then, I guess, for the training. But I guess I'm listening to you. If you had the choice, you'd rather go to a conference as opposed to doing it online or?
Oh, yeah. Oh, yes. Yeah. Now, the poor young dentists who come out with all those school loans, they're kind of stuck because it's expensive to go to some of these conventions.
Right.
And institutes.
So back to choosing a dentist. So you can, as you mentioned, you can try to research it, but there's some other things you can do. If, again, I'm new to the area, what else do you tell people to do to find a dentist?
Ask their friends.
Okay.
Ask their friends. And there's different, you don't know whether their dentistry is good. And as a matter of fact, for the most part, patients don't care whether their doctor is a good surgeon. What they care about is if they have a good personality. And that's something to think about, that, it's human nature to choose your doctor or dentist, your surgeon, what specialist, whatever, by their personality. And they may not be the best. Now in dentistry, or even your primary care physician, if you don't like the person, that's a problem because there is communication that has to go on.
That's funny. I never thought about it until I think I told you the story where I had a dentist who I liked and still like very much, but referred me to a specialist. I didn't like the specialist at all, and I had to go back to another specialist several years later. And I said, no, I'm not going to that one. I chose another one, but it does make a difference. Also, you probably know it more than I do. Statistics show too that if a dentist is nice and you like dentists and friendly with dentists, they're less likely to be sued, right, than somebody who you don't like.
That's exactly right. And I'll tell you, if your doctor, your primary care or your dentist refers you to a specific person,
right,
specific specialist, there's a reason they did that. There's a reason they did that, and there must be. I would go to that person whether I liked them or not.
Right. Well, I did the first time. Yeah, I did the first time, but I had such a negative experience, and they gave me another dentist and he's fine. But that's a good point. That I guess that's another way. Let me ask you for getting opinion for dentists or any other professions. Sometimes by asking another professional. In other words, if I asked Dr. Gillespie or if I asked you, how do you feel about a doctor or somebody else? No offense to other people, I value your opinion a lot more than some other people's opinion because you're a professional and who you use. I would think you've done some degree of research. So
sure.
I don't know. Do people ask? Is that a legitimate question to ask you, dentist?
Absolutely.
If you need a referral to another medical profession.
If they know, then sure. Sometimes they know.
Yeah. And will you give that reference?
I think most of us would. I would.
Okay. Or again, what you said, and again, you're an example of it. I guess if you become friendly with a person, you develop a relationship, with somebody as opposed to just somebody you see off the street, so that most of your patients, I assume, have seen you. You've been there since 2015. Most of your patients have seen you for a while.
Oh, sure. Absolutely.
And somebody told me, is this true? I think it was a dentist, that out of all the professions out there, people who travel further to see a dentist than almost any other medical profession. Have you heard that at all?
Oh, that's really true.
Yeah,
I mean, I actually, a patient from upstate New York found me here.
really? Yeah.
Yes, one patient, because that's a long ways to go.
And
But
still
there
still
is
lives
such a,
still lives in upstate New York, that patient?
no, she was moving down this way.
Oh, no, but I had a friend, a good friend of mine, was a dentist in Pennsylvania, and he would say people from Florida, they make their trip up once a year to see him.
Mhm.
And you don't see that in too many other professions.
It's a very, first of all, your relationship with your dentist is intimate. I mean, we're very close
Right, right.
and physically close when we work. And it has to be a very trusting relationship. The patient has got to trust the dentist with what they're doing. And you see them enough to get to know them. So
No,
that's why that is.
that's true, because again, I would travel
Yeah.
for a dentist. I wouldn't travel, too many other professions. And I guess that ties into maybe one or two last questions, but about in the Asheville area, are there enough dentists?
If everybody who needed to go to the dentist went, no, there are not. Actually, there aren't, right? There aren't enough dentists, there are not enough hygienists, and there are not enough assistants right now.
Yeah, because
We're, yeah,
because that's
it's a
happening
problem. It's a
in other
problem.
practice, in other fields as well.
Yeah.
It's getting, I guess, increasingly hard to get in to see some professions. So I guess the recommendation, I guess we're both coming up with together, is that if you have a relationship with a dentist, it's something you should work toward and to keep, because you don't want to be you don't want to be shopping dentists all the time or going from one dentist to another.
And buy an electric toothbrush.
Okay, good advice. Jenny, if folks want to get in touch with the practice or want to come to Dr. Gillespie, I should ask, I guess, in general, the first question is your practice still accepting new patients?
Yes, we are.
Okay, because that's again also frustrating, not so much with dentists, but I can't believe it that doctors saying they don't accept new patients. But you can get in to see the practice.
We increased our hours a little bit on Fridays.
And so what's best bet to find out more information?
All you have to do is Google Dr. Gillespie and Associates. He's
Okay.
on Orange Street, which is off Merriman in Asheville.
And you told me something off the air, which is kind of interesting. You can also get a chance to talk with you personally, or also the practice is on Fridays. It was in Asheville.
After 5, downtown Asheville. After 5 is
Okay.
and it's fun.
Okay, and they're going to have Dr. Gillespie, the practice is going to have a booth there, or they'll have
Yes.
someplace you can speak to people.
Yep, we're going to have a booth there.
Okay, so if you want to find out more about the practice, kind of the best bet, either go to the website or come to downtown after 5, or ask around. But I think you'll hear good things about Dr. Gillespie, and you'll certainly hear good things about Jenny. And I'd like to thank you for being my guest on this edition of the Blaine's World podcast. I'd also like to thank my producer, Cappy Seti, and we hope to see you personally, hopefully in the near future. And as always, a pleasure, Jenny. Good speaking to you, buddy.
Thank you, Blaine.
Okay, stay with me 1 second while I sign off.